Primetime, everybody. Tonight, Mandy Reece, a pharmacist and diabetes educator, will be answering your questions about diabetes and medications. And our giveaway tonight are some delicious, diabetes-friendly summer recipes. So let's get started. Mandy, thank you so much for joining us tonight. It's such a pleasure to have you here with us.
I'm excited to be here.
Well, when the people in our Facebook group found out that we were talking to a diabetes educator who was also a pharmacist, they had a ton of questions. So I'd like to just jump in with those questions now, if that's okay with you.
Let's get started.
Okay, wonderful. So the first one is a fairly straightforward question about metformin from Amma. She asks, when is the best time of the day to take short-acting metformin, as well as long-acting metformin? And she says, thank you. So what would you say to Amma?
Amma, first of all, that's a great question. To start with, for short-acting metformin, I typically recommend for folks to take it with their first meal of the day and their last meal of the day to decrease that stomach upset that sometimes metformin, particularly short-acting, can cause. Also, to make sure they take it with food, and the doses need to be about 10 to 12 hours apart. Now, for long-acting metformin, I typically recommend taking that in the evening or at bedtime with a small snack because it's actually going to help that liver from dumping out too much sugar overnight.
So that's a really good point. You focused on a couple things I want to jump in and ask you about. So I know that stomach upset is the number one reason, the number one challenge that people have with metformin. So what I hear you saying is making sure that you take it with food can make a big difference with that as a side effect.
Yes. And the other trick that I recommend to folks is make sure you take a probiotic, as that will also help decrease the stomach upset that is associated with metformin.
So let's talk a little bit about metformin, or vitamin M, as our endocrinologist, Dr. Jackson, likes to talk about it. It's a fantastic medication, isn't it?
It really is. And it's a safe medication.
Because we've had it for a long time. We know it's effective. We know it's safe. Yes. While we're talking about this, though, I just want to make a quick point, which is to say that this show is all about information. We don't give medical advice. Mandy is super knowledgeable and a fantastic pharmacist, but you always want to talk to your doctor about your specific situation before you make any change in medication. Yes. So a very important point we want to just make right up front. So Yvonne has another question about metformin. She asks, should I be wary of an interaction of metformin with any hypertension medications? Great question, Yvonne. What would you say to Yvonne?
So what I would say is there's a couple of classes of blood pressure medications that have act differently with metformin. First of all, are calcium channel blockers, which is just a class of medications that's used to treat high blood pressure. So drug names such as amlodipine, nifedipine, those actually decrease the level of the metformin. So therefore, it's not going to do as good of a job at lowering the blood sugar. On the other hand, the other class of medications called ACE inhibitors, commonly used with persons with high blood pressure and diabetes because it actually helps protect the kidneys, can actually cause increased levels of metformin.
Oh, wow. Okay, so being aware of what you're taking with other medications is always a really good idea, is what I hear you saying.
Yes, it's always a great idea. And particularly for folks, if you are seeing a number of different physicians or providers, really making sure you're letting each provider know all the medications that you're taking, because if they don't know, then there's no way to check for drug interactions and that type of thing.
And that's really kind of the role of a pharmacist, is they can coordinate between a lot of different specialists, because people do see a lot of different doctors, and it's easy sometimes for things to slip through the cracks. And that's why pharmacists play such an important role. The second question that Yvonne has is one that I know a lot of people with diabetes have, which is, do you have any suggestions on diabetes-friendly cold or allergy medications? Which is such a common question. So if someone with diabetes is sick, what should they be thinking about when they're choosing a cold medicine or allergy medication?
That's an excellent question, a very common question. So before I answer about the specific products that I would recommend, some thoughts before you go to the pharmacy. First of all, identify what specific symptoms you actually have. More is not always better when it comes to medications, particularly over-the-counter medications. So first of all, is it a cough? Is it nasal congestion? What specific symptoms do you have? Next, tip I have is utilize your pharmacist. Talk with them. Let them do an interaction check with all the medications that you're actually currently already taking. And then in terms of specific symptoms, things I recommend. So for a dry cough, a diphenhydramine, which is Benadryl, dextromorphin, and then if you have a cough that you just can't get it all out and you feel like something is in there and it's just not coming out, a product called guaifenesin helps with that. And then nasal congestion, the old saline rinse, as simple as that sounds, doing
can
that
make a big
twice
difference.
a day. Yes. And probably the number one tip I'm going to give is watch the sugar that is in a lot of the lozenges, that's in the cold and cough medications. They are packed full of sugar. So make sure that if you have diabetes that you want to get the sugar free. And honestly, I would recommend that for people without diabetes.
Because why eat a bunch of sugar if you don't need to?
Right,
and I know, like when I have a cough, I'm taking lozenges all the time. And if those have sugar, I'm eating a lot of sugar, not really being aware of it or really having fun with it either. I think I'd rather have dessert than cough drops that have sugar in them.
And there's one other tip I have for folks that have diabetes and they have high blood pressure. They want to stay away from decongestants, because what those can cause, they can actually cause the blood pressure to go high. And
that's a really important point.
Yes. And more is not always better when it comes to Tylenol. So you don't want to max out on more than 4 grams a day, because you could end up in the ER because it's going to hurt your liver. So make sure that you're looking at the products, and when you're going to select a product, the less the number of primary ingredients, the better.
So just less additives and things like that. I want to call out one thing, because I know men in particular, the men in my life, can be challenging with this, taking more than the label says to take. Because it's like, well, I feel terrible, so I really want to make sure that that all my symptoms go away. What I hear you saying is that's not a good idea.
Right. And that makes me think of my father-in-law who passed away last year. He said, if one is good, two's even better. And
I've heard that before.
Here.
Okay, folks, it is time for our trivia question. Tonight's trivia question is sponsored by Arcray, and if you answer the question tonight, you will get some delicious summer recipes put together by our awesome diabetes dietitian, Melinda. So our trivia question tonight is, according to the International Diabetes Federation, what country has the highest number of people currently living with diabetes? Is it A, China, B, Canada, or C, the United States? Again, that question, what country has the highest number of people living with diabetes in the world? Is it A, China, B, Canada, or C, the US? Leave an answer for us in the comments and you will get our yummy recipes delivered to your Facebook Messenger inbox. And trivia tonight is brought to you by Arcray. Arcray has been working for over 50 years to make the lives of people with diabetes simpler and easier. Their blood glucose monitoring products and personalized approach to diabetes management helps empower people to live richer, healthier lives. They make our show possible and we appreciate it. All right, Mandy. Nikki asks a question that is, my insurance no longer covers metformin ER. What is a good alternative? So I was a little surprised to hear that, because metformin is such a commonly prescribed medication. And I know at a lot of grocery stores and drugstores, it's $4. But given that reality, what would you suggest for Nikki?
So for Nikki, I would recommend a couple of things. One is to check to see if her insurance covers metformin XR, which is a slightly different formulation than the ER. My other thought would be option 2 would be to go back to the immediate release. And if there is some stomach upset, take it with food and then add a probiotic so that you're helping the stomach with that.
Awesome. Well, and I think that brings up a larger question of what to do when insurance isn't covering the medication you need, or if you're struggling to afford medication, whether or not you have insurance. So if someone's in that situation, I've either lost insurance or I don't have great insurance, and I have diabetes, where would you suggest that someone start?
Okay. And that is a reality for millions of Americans who are living today who can't afford their diabetes medications. They may have health insurance, but it just doesn't cover what they need. And working with people living with diabetes day in and day out, I really understand that reality. So my first, there's several thoughts I have on this. One is to check to see what your insurance covers in terms of diabetes medication. medications.
Great point.
Become educated. And it's called a drug formulary list. And it's just basically a list of preferred medications. Your generic drugs, which are going to be inexpensive, are going to be your cheapest. Your brand name products are going to be more expensive. So learn what's on your formulary, and that can actually change from year to year. And I encourage you, have it on your phone, take in a copy when you go see your healthcare provider.
Absolutely.
So you are armed with that information right then and there.
Great point.
Yes. Second, oftentimes their provider's office may need to do something, what's called a prior authorization, where they have to submit some paperwork that says you've tried drug A and B before you can have drug C. So talking to your provider about if a prior authorization is needed. Now, heads up, that may take a couple of weeks to get the approval for that. Next is, you may be taking a medication such as Trulicity or something as that. It's what we call a GLP-1 agonist. It helps the stomach. It gives it a little bit more of that incretin hormone, which is a good thing.
It's a very good thing.
Yes, but your insurance may favor Ozempic or prefer it on the drug formulary list, so you may need to change over to a different drug in the same class. So that's a situation sometimes where one's preferred over the other, and that makes a difference in cost.
Can I just interrupt you there? Because
Yes.
I think increasingly that is a challenge for people. They're
Yes.
changed from one medication to another every year or when they change insurance. I really liked your suggestion that you bring the formulary in to your doctor or your nurse practitioner and say, okay, here's what's covered. What should I be getting? But it's also probably a good idea that when someone's formulary changes, that they talk to their doctor about, what should I know when I'm moving from this medication to that medication? Because that's happening so often.
It is.
Are there any tips you would suggest that someone bring up with their doctor, like dosing changes or anything like that?
Yes. Now, I will tell you, quite often the providers will know if you're switching from drug A to drug B, the dosing is not going to be the same. So don't expect the dose to be the same. But also have that conversation with them about if you have specific concerns. Now, I advise don't watch the TV commercials with stop every side effect. You'll never want to take a drug again. Don't do that.
We'll talk about that in a minute, too.
Yes. But certainly have that conversations. If you do have concerns about that, discuss that with your provider in depth.
I think that's a really, really great point. Yeah. Anything else about affordability?
Yes. There is oftentimes copay cards if you do have health insurance, non-government funded health insurance. So copay cards can actually help with the cost. I actually have an asthma medication that would cost $300. Because of a copay card, it's $10. So, and then the other website I recommend is called needymeds.org. Excellent website.
Great
and
website.
It has all of those patient assistance programs listed there on the website.
That's great. And those copay cards, honestly, can make a huge difference because, they can, as you said, take a medication cost from $300 to $15, $25, and it makes a big difference. I'm also going to put a plug in here for Walmart and their Relion brand. If you're on insulin and your insurance changes or you're in the donut hole, it is human insulin, which is different than modern insulins like Lantus or Levemir. But they are $25 a vial, $25 for a 10 ml vial. So that can make a huge difference for people on insulin. You just definitely want to talk to your doctor before you do that, or talk to your pharmacist before you do that, because dosing is definitely going to be different.
Dosing will be different, particularly for your basal or your background insulin in particular. So that's what we have to be concerned about. And you can actually buy the Relion insulin without a prescription since it is a human insulin.
Correct. That's exactly right. Wow, that's a really good point. All right, so we're going to keep talking more about medications. We have our Amazon Choice comment of the week from Crystal. This is a long comment, but it's worth it. Almost all type 2 medications have some undesirable side effects, but in my experience, not very many people actually experience those side effects. I've seen people refuse to take their meds because of the side effects listed. How often do those scary side effects often actually happen? And which is worse in the long run, high blood glucose or medications? Before you answer that, though, I just want to say a thank you to our sponsor, Amazon's choice brand of blood glucose monitors and blood pressure monitors. They make healthcare more affordable. All right, Mandy, so let's talk a little bit about the realities of side effects and medications and whether they're worth it. And that gets back to those scary commercials you were talking about earlier.
Yes, I would definitely say the medications are worth it over the high blood sugar, because the high blood sugars do affect the nerves and the small blood vessels throughout our body. So we may not feel it immediately, but long term we will feel it. And that can be kind of scary and costs us a lot of money long term. So it's important to be knowledgeable. So a little bit of background information. When you think about side effects, if you were to pull out a package insert for a medication and you look at it, you think, geez, I'm not going to take that. Or you watch a commercial. Don't let that scare you. What they do is they actually have to track all the side effects that the people in the studies, the drug trials, experience. And you'll see sections on the package insert, and they'll say, this happened, this side effect happened in less than 1% of all folks in the study. Then they'll have the next category, 1 to 3%, or greater than 10%. Now, I tell you, for the most part, you're really going to look down at that greater than 10%. That's the side effects you most likely may experience. It doesn't mean you're going to experience them. So
it is still 1 in 10 people who had them if it's
right.
a 10% occurrence.
Right. And this is another important point. If you are experiencing a side effect from a medication, don't just stop taking it and not let your provider know. Go ahead and call your healthcare professional, whether it's a physician assistant, a nurse practitioner, or a physician. Give them a call, let them know you're experiencing this side effect, and talk about alternative medications, because there are alternative medications available.
I think that's such a good point, because I understand if I was experiencing something that wasn't pleasant, I would just want to stop. But it really is important to make that call and let them know. All right, so this is a really important moment to talk about why we take diabetes medications at all, because they work, right? They work to lower our A1C, and those complications that you talked about are scary. And a lot of times, diet and exercise just aren't enough to get our A1C where it needs to be. So talk just a little bit about why it is so important to take those medications that have been prescribed as they have been prescribed.
Okay, perfect. So first, I always like to tell folks is it's not a message of failure that you need medication. And I think people need to hear that message. You have not somehow failed. It's the nature of the disease itself. You will need medication at some point in time. Now, that medication is individualized based for what each person living with diabetes needs. So don't compare yourself to a friend or a family member.
You got different genetics than they do.
Right.
Yeah, exactly.
Exactly. No two persons are the same. And if we think about that, we don't want to get complications from diabetes. So we don't want to have dialysis in 20 years. We don't want to experience blindness, and we don't have to experience those things. And that's the reason why it's important to take the medications. But at the same time, if you have concerns, discuss that with your provider, and please do not view having to take any type of diabetes medication as a message of somehow you've failed.
That it's your fault or that you've done something wrong.
Yes.
And again, it's really important here to emphasize, blindness, amputation, neuropathy, those are not inevitable side effects of diabetes at all. It is very possible to live a long, healthy life. It's just a matter of keeping that A1C and your key numbers where they need to be. And medication is such an important tool for that for so many people. So I think another important point to bring up here is that diabetes medications or blood glucose lowering medications are not the only medications that people with diabetes need to take. Mm-hmm. So what should a person with diabetes make sure they talk with their doctor about as it relates to other medications, whether it's blood pressure medications, cholesterol medications? What's kind of the whole picture for a healthy life with diabetes?
Okay. So I like to tell folks with diabetes that I'm talking with is to create a conversation that diabetes doesn't occur in a silo. Now, when we're talking about type 2 diabetes, we often see high blood pressure and elevated cholesterol levels along with type 2 diabetes. It's all part of that metabolic syndrome.
That's right.
Personally, I like to call it the three musketeers. They tend to stick together. Now,
they do. I mean, 80% of people with type 2 have hypertension. So you're not wrong.
And so it's going to be very important for that person living with type 2 diabetes to make sure they're taking their blood pressure pressure medication, their cholesterol medication. Now, I do want to put a plug here. Make sure you have a dialogue, a conversation with your provider about those medications. You need to be involved in that dialogue and that discussion. You need to voice your concerns if you have that. Now, for folks with type 1 diabetes, it's different because it's an autoimmune. The body's attacked itself, so they may have other chronic diseases related to autoimmune.
Got it. So two very different kind of hosts of diseases that can go along with diabetes.
Yes.
Oh, I think that's a really good point. And back to our question about complications, oftentimes preventing blood pressure, lowering blood pressure and keeping that at target is as important as keeping A1C at target for preventing those diabetes complications.
Yes.
So very important to take those blood pressure medications as prescribed.
Yes.
So another question that often comes up is what supplements or vitamins should people with diabetes be taking? And I say that knowing we, as Americans, we really like our supplements and vitamins, don't we?
We do. We really love our supplements and vitamins. And I'm a person, I take fish oil every day. I take glucosamine and chondroitin every day. So I'm one of those fellow Americans that loves my supplements. So I will tell you, there's a lot of supplements and vitamins that are advertised for persons living with diabetes. The challenge with that is there's not a lot of solid science to back it up. So there are 3 specific supplements that I say are beneficial. A person with diabetes doesn't have to have them. One is alpha lipoic acid, and particularly if a person with diabetes has nerve damage, also called neuropathy. Alpha lipoic acid can actually help relieve some of that pain. It's not a cure-all. Next would be coenzyme Q10. It's actually good for heart protection if you're taking a group of drugs called the statins. It also is helpful for that Lipitor, Crestor, those types of drugs. And then the third one is milk thistle, as milk thistle actually helps protect the liver, interestingly, and it also helps glucose lowering. So it decreases inflammation. It also decreases insulin resistance as well. Now, there's some others out there that folks may use, such as cinnamon, Nepal, some of those, but I don't really recommend those as being beneficial. So, vitamins and supplements are another area where more is not always better.
Absolutely.
So really do your homework before you go spend a lot of money on that.
There are a lot of products that are advertising themselves as diabetes cure-alls. And I would say in general, if they worked as advertised, probably every person with diabetes would be taking them. Your doctor would be telling you about them. So always a little bit of healthy skepticism is a good idea. But I think we want to be talking about our supplements absolutely to our pharmacist and our doctor as much as we're talking about other medications, correct?
Yes. So every time you go in to see your provider, you go into the pharmacy, make sure they know all the supplements and vitamins that you're taking. Even ones that you may not buy at the pharmacy, maybe you order them online or you buy them at the natural food store, make sure that they know, because there are lots of drug interactions and your provider, your pharmacist have no way of knowing if they're not told that that's what you're taking. And don't worry about feeling judged by your provider, your pharmacist. We just need to be able to do it to check for potential drug interactions and to keep you safe as a person living with diabetes.
Great point. All right. So next we have 2 questions about insulin. So Judy says, when should you talk to your doctor about increasing or decreasing your insulin dose? Judy, that is probably the most important question someone could be talking to their doctor about. What would you say to Judy?
Okay, several points here that really come to mind, because the insulin's one sort of medication I work with quite a bit, and that is, so if, let's say you change jobs and you go from a work that you're not as physically active to work where you're very physically active. Your insulin needs are going to decrease because you're more physically active. That decreases your insulin resistance. You would need a dose decrease, versus if you were to go from a work where you were very active to more of a sedentary, like sitting at a desk, your insulin needs could increase. Another time where insulin needs would be changed is if you lose weight. weight. If you lose 10 or more pounds, your body's not going to need as much insulin because there's not as much there. So the insulin,
or probably if you're changing an eating pattern, for example, if you're trying to eat fewer carbs, that might be, I'm asking, that may not be the case.
Actually is the case. So for folks, I know some folks are doing a keto diet, which can work great short term for some folks. Your insulin needs are going to decrease because you're not taking in as many carbohydrates. And if you gain weight, and don't feel judged. We all do it. Every one of us. We have
especially around the holidays.
Yes.
We're all human.
So our insulin needs are going to actually increase during that time as well.
That is a great question. All right. Speaking of weight loss, Gloria asks, is it possible to lose weight when you have to take insulin 4 times a day? A really good question, and I'm actually kind of curious to hear what the answer to that is.
I will say yes, but it's tough. It is tough. So what I recommend folks to do is potentially not cut your carbs out, but for women, keep your carbs at about 2 servings per meal, men 3 servings per meal.
2 servings meaning about 30 grams?
30 grams.
3 servings meaning about 45 grams. Okay,
per
got it.
meal.
Yep.
Increase your water intake, increase your number of steps, your physical activity each day. Be very mindful of what you're eating. Some folks actually find that keeping a food journal is a very helpful, so they can be mindful about what they're eating. Also, if a person tends towards emotional eating like myself, really tracking how are you feeling when you eat, and keep that food and emotion journal. So
that's a great idea.
It's tough. I'll tell you, it's not easy, but it is doable.
Oh, that's a great answer. Yeah. All right, last question. Avaneg asks, when it comes to blood pressure medications, is there any connection to weight gain or loss and fluid buildup and loss, which I had really never thought about. So I'm kind of curious to hear your answer to Avaneg.
Yes, there's one particular blood pressure medication that stands out in my mind. It's called amlodipine or Norvasc. It's a calcium channel blocker. That's the big fancy name for the drug class. And that can actually cause swelling in the legs and the feet, versus if somebody is taking what's called a diuretic, which is basically AKA a water pill. It helps you pee. The person is going to decrease the amount of fluid that they're retaining.
Wow, this has been a jam-packed show. Mandy, I cannot thank you enough for joining us tonight. Before we go, I just want to say quickly, you're a fantastic educator and pharmacist.
Thank you.
There are a lot of people out there in the world like you. If you would like to see a diabetes educator like Mandy get personalized advice, we will put a link in the show notes to find a diabetes educator near you, because they are an invaluable resource for people with type 2 diabetes. So thank you so much for sharing your wisdom with us tonight.
Would you mind if I put in a little plug to explain what a diabetes educator
Yes, please
can
do. Yes,
so
great idea.
A diabetes educator isn't just going to throw pamphlets at somebody. They're going to have an in-depth dialogue and discussion with the person living with prediabetes or diabetes to develop a self-management plan for that person living with diabetes. If they're a pharmacist, they're a nurse practitioner or a PA, a physician, they could be involved in the clinical management of diabetes. Also with technology, discussing technology options, apps,
devices,
insulin pumps, CGMs, all of that. And then also the behavioral piece, what we call like kind of the psychosocial. So how do we manage those habits? How do we manage our anxiety? Do we manage depression? Those lifestyle, behavioral types of things, which are so often, they're so hard to change.
And also, you talked about a food journal earlier. And I think sometimes just reviewing a food journal with someone else who can kind of help you see those patterns that are hard for you to see in a very non-judgmental way. I mean, that can make a huge difference for folks. So thank you very much for explaining what a diabetes educator is. They're so important. So definitely go see a diabetes educator and check out Mandy's amazing blog. It's called Reese's Pieces, and it's a fantastic look at what's happening in the diabetes world. So we'll put a link to that in the show notes as well. Before we go, here is the answer to tonight's trivia question. The country with the most people living with diabetes in the world is A, China. They actually have 114 million people living with diabetes, compared to 30 million people in the US and 2.6 million people in Canada. Everyone who answered the question tonight or left a comment for us will get our delicious summer recipes delivered to their Facebook Messenger account for free. So if you haven't done so yet, please go ahead. We'll be back for our next episode on Tuesday evening, July 9th at 8 p.m. Eastern. We hope you'll be able to join us. Until then, thank you so much for joining us tonight, Mandy. We will have you on again. You've shared so much information with us, and we'll look forward to the next time.
Thank you so much. It's been fun.
Good night, everybody.